sleep is is a condition that brings people in to see a physician frequently. And if it's not the primary reason people come in to see us, it will be one of the secondary reasons. You can have sleep disruptions for any number of reasons. How many of you all currently have difficulty sleeping? Okay, no wonder you're here. And if you have not had difficulty sleeping at some point in our lives, most of us do, or we live with someone who does. So difficulty sleeping impacts us in a lot of ways. What's fascinating about sleep is sleep disruptions can be primary or secondary. There are at least 10 categories of sleep disruptions in the clinical literature. Figuring out which one of those, or maybe more than one of those, are part of what's going on with you is something to explore with your physician. And one of the effects, as everybody who's experienced this knows, of sleep disruptions is impaired function in your daily life. And that's actually one of the criteria that has to be present in order for a sleep disturbance to be called insomnia. And so sleep disturbances can include difficulty falling asleep, difficulty maintaining sleep, waking early in the morning, and that one is classic for, as we get older in life, for being one of the biggest factors. There can be non-restorative or poor quality to the sleep. And again, there has to be an impaired function in your daily life to be classified as insomnia. We also have to make sure that you have the conditions present that would allow you to sleep if you were able to, and that you have the opportunity to sleep. A lot of people work variable schedules, and that is a huge factor for negative impact on sleep. That variable schedule, not just working nights or working swing shift, but that variable schedule where maybe for 2 days you'll work swing, another 3 days you'll work nights, and then all of a sudden you're on daytime hours. It's the mind and the body the circadian rhythm is completely disrupted, and people have a lot of challenge sleeping in that circumstance. And that one is very difficult to treat as well. It's really challenging because you can get people to sleep at night and in the afternoon and even in the daytime, but sleeping at variable times of the day just doesn't work for us humans. Yeah, so I have a couple brothers who are construction supervisors, and they'll have jobs where they work so many different hours of the day and days of the week. And we've worked out very elaborate treatment plans for them, which sometimes work and sometimes don't. There is acute insomnia. There can be acute or persistent insomnia. So acute usually has an identifiable trigger. With acute insomnia, you'll know it all of a sudden starts. Someone gets sick, a loss or a death in the family, a change in work circumstance, financial stressors, change in work schedule. And it usually resolves with a change or a shift in the trigger stressor. However, not always. Sometimes we just get primed and we have the pattern going and we need some help to change the pattern or shift it. We either resolve the stressor or we adapt to it because we are eminently adaptable as humans. We can adapt to amazing things. can have moved to a new place, or they'll begin construction. And normally you sleep until a certain time of the day, but all of a sudden there's building going on near you. There can be a change in the sleeping environment. There can be changes in your intake of caffeine, alcohol, drugs, either recreational or over-the-counter or prescription. Many prescription drugs have secondary effects of sleep disturbances. A lot of over-the-counter products, which are not about sleep at all, can disrupt your circadian rhythms, either positively or negatively. Benadryl is one of the good examples of that. Some people take Benadryl to be able to sleep because it calms them down, suppresses, gets them to sleep. But for some people, anti-inflammatories are excitatory to the brain, so they can't take them before bedtime. We are all unique individuals. And so figuring out what the triggers are for each of us can take some time. And again, changes in the sleeping environment, animals, either a change in the health of your animal, a new animal, or the loss of an animal. If you're used to sleeping with one, all of a sudden they're gone, that can be difficult, both emotionally and also just physically for the change in the sleep environment. So caffeine, alcohol, which does help people fall asleep, but it can lead to lighter sleep or disrupted sleep. Very common to wake in the middle of the night, somewhere between midnight and 3 in the morning, and have difficulty getting back to sleep after drinking alcohol. Drinking caffeine, especially afternoon, if you are sensitive or your nervous system is worn down from chronic stress. And you're exhausted, so of course by 2 in the afternoon, you want a cup of tea or a cup of coffee, because you can hardly drag yourself through the rest of your day. But it doesn't serve you, because then come bedtime, more challenging to fall asleep. Pain or illness, either yours or your partner's, can make your sleep more restless, make it difficult to fall asleep, and especially to maintain sleep. There are common conditions where sleep disruptions can be part of the illness or imbalance. And then stressful, both good and bad. Stress is just stress. Body can't differentiate whether it's good stress or bad stress. It's just stress. And so that can also cause sleep disruptions. Okay, whoops. So they've done a lot of studies about insomnia, as you can imagine, and the animal studies tend to indicate across many animals, many that are similar to us, that stress-induced insomnia is more about having us be more sensitive to arousal triggers rather than really disrupting the sleep itself, which is interesting. And it explains why so many of the more gentle treatments that work at tonifying or strengthening the immune system or the endocrine system are actually effective for promoting sleep. Yeah, so, the brain's only job is to think and solve problems for the most part. That's what it does. It thinks, it solves problems, it analyzes, it processes. And so when people are highly stressed, we have high levels of cortisol, which stimulates in our midbrain the release of excitatory hormones, the glucocorticoids, which tend to become sensitized. The more they're stimulated, the more easily they will pour out into our body, the more the receptors in the different areas of our body will respond. And so once you get that cycle going, that excitatory cycle going it can be challenging to get it to calm down and become less easily stimulated. And so one of the ways I explain this is if you take a muscle that is not used to working out and you work it out a lot, all of a sudden it gets used to working out. If you work out harder, you'll get more of a response, and it responds quicker every time you increase the level of your workout. Well, the brain and nervous system are like that too. It's like we are, yeah. Did that explain it? Good. Okay. So circadian rhythm sleep disorders are a little different. That's your classic jet lag. You know, where they tell you to start setting your clock back for an hour every 2 to 3 days before you transition, so that you'll be able to fall asleep once you get there and stay asleep once you get there. The classic for me was going to Vietnam, where I did not sleep for 2 full days. 2 days, no sleep at all, not an hour. I could not fall asleep. Not only because of the shift in circadian rhythm, but also the stimulus there, the noise, the smells, the activity levels. Very exciting. So I had the 2 going on. It was quite interesting, almost like drugs. Yeah. So jet lag. And it gets worse if you go over more than one time zone. You all probably have seen this in yourselves. Going to New York is much more challenging than coming home from New York. Night work, we talked a little bit about that. The world is also not set up to support daytime sleepers. The phone rings, people are busy and loud outside. It's hard to get the environment to the place you need it to be dark enough, to be quiet enough, to sustain sleep, and to work against your own brain. And then there's also high altitude. You change altitudes, that high altitude insomnia. Changing altitudes is very stimulating to our brain. So if you go to Denver to go skiing, not only are you changing time zones, but you're also changing altitude. And so often you'll have other high altitude concomitants, what we call them, but conditions accompanying that. So you may have the headache, the change in breathing, that sort of rapid, almost hyperventilation, which is called Cheyne-Stokes breathing. You'll have all of that, and muscle fatigue, almost a malaise if you go skiing the first day or the second day. That's just because our red blood cells are not carrying enough oxygen when you put us at 10,000 feet or 8,000 feet. So, yeah, high altitude insomnia is another type of circadian rhythm disorders. So then there's chronic or extended insomnia. And that's the one that goes, it doesn't resolve after the acute triggers are gone. We don't adapt. It lasts for over 3 months, and it may occur for years and years. It's usually intermittent rather than every single night. Very rare that it would be every single night. And some of these are from learned behavior, because as humans we adapt. So we've adapted to not sleeping. Our brains are adapted to that at a certain point. Now we have to retrain it. Learned insomnia, the racing thoughts or increased mental content, disruption of sleeping, or as I call it, the hamster mind, where your brain just gets on the wheel and it keeps turning and turning and turning, even in the middle of, I'm only going to get 5 hours of sleep if this doesn't stop, or 4 hours, or 3 hours, or whatever else it is. And then that worry about not sleeping exacerbates the not sleeping. So, and all of this occurs in regular, normal, fairly healthy human beings. And it's not usually due to psychological disorders like depression and anxiety, although those can be factors with insomnia as well. So, so the physiologic, there's also the chronic insomnia. There's the physiologic or secondary insomnia, and that's the kind of sleep disorder that accompanies another condition or is due to another condition. So you're looking at underlying diseases, pulmonary or respiratory disease, like asthma, like COPD, where when you lay flat, it's a burden for the body to breathe and transmit oxygen, and so you're laying down flat to sleep. Your body's having difficulty getting enough oxygen, which actually impairs sleep function. Often patients with chronic respiratory disease sleep better if they're sitting up in a chair or they're propped up by many pillows. Some of the difficulty sleeping can also be secondary to the medications that are used to manage COPD or asthma, because some of those are very stimulating substances, like the corticosteroids, right? So, and if there's pulmonary disease and you lay flat, we all know about chronic sinusitis or chronic asthma, where the mucus and the secretions can pool and build up and hamper breathing. And so you wake up to cough. And there's that chronic pattern that gets set up. Pain inhibits sleep, especially chronic and relatively severe pain. So musculoskeletal disorders, cancers, autoimmune disease, all of those. So, and then cardiovascular disease. If you're taking diuretics, you have to go to the bathroom all the time and get up in the night to urinate and disrupt your sleep more than once or more. So there can be a lot of these factors as well. Some other, they're called psychological disorders, but there's, truthfully, restless leg is not a psychological disorder. It's a physical manifestation. I kind of didn't like that, but sorry. There's periodic movement disorder syndrome, sleep apnea. There's myriads of these things, all of which impact the quality or quantity of sleep in major ways. So as naturopaths, what do? We need to figure out all of the physiological conditions that may be contributing to your lack of sleep. All of these in different people may not manifest with insomnia, but in some people they will. So the symptoms of insomnia, many of us know these well. So daytime sleepiness, or a decrease in our mental alertness or our ability to think, impaired memory, fatigue, of course, especially worse midday, mid-afternoon, and then we'll get recharged again somehow, often by caffeine or by eating food or sugar or something that's a little stimulating. Decreased motivation. Sometimes feeling moody or slightly sad or depressed without reason that resolves after a while, or irritability, the inability to take any more stimulus because our buffer zones are already overrun. One more thing. You can't take one more thing. That feeling like there's no space around you to tolerate it any longer. Headaches. we can be prone to accidents, either car accidents or just physical injury, falling down, slipping, turning and walking into a door instead of through the doorway, just from not being present because you're so tired and trying to remember what you were supposed to be doing or engaged with something like mental. And then worrying about your lack of sleep. Worrying about sleep is one of the major obstacles to curing insomnia, because we develop that pattern where you go to bed and you wonder, am I going to be able to sleep, and what if I can't sleep, and where do I go from here? Okay, so any questions? Okay. So there are a lot of different tools for treating insomnia. And as a naturopathic doctor, there are many we use before we move on to some of the bigger guns. So in one of our philosophies is that we want to use the least invasive treatment we possibly can. So one of the first things that we look at is the behavior, the sleep hygiene, what we call sleep hygiene. And sleep hygiene is the environment surrounding sleep. It's everything from the physical room we sleep in, to the behaviors we use before bedtime, to the mental self-talk we exhibit at bedtime, to the activities that we do, okay? To foods we eat, to things we drink. It's the whole picture, that sort of entire environment. Medication, which is what we think of as a bigger gun, that would be sort of the last choice if nothing else is working. We like to use tools such as hydrotherapy, which is the use of hot and cold or heat alone or cold alone, water as treatment, because you can use water as a treatment to induce parasympathetic activity, nervous system activity in the body. You all remember sympathetic nervous system versus parasympathetic? Parasympathetic is the autonomic nervous system. It's what allows us to breathe. All the things we do without even thinking about it. We don't have to do anything, it just happens. But in this world and society, it's difficult to maintain a parasympathetic dominance. Our society is one of stimulation, of working, of pushing, of constant engagement in stimulus and driving in traffic and having to pay attention and getting things done by certain times of the day, of computers and emails and showing up on Tuesday with 165 emails in your box that you're supposed to get through by the end of the day, with 15 phone calls, plus your worry over whatever's going on at home and the other deadlines you're supposed to meet that day at work. We all have it in one way or another, whatever that is. But that sort of chronic, constant stimulation of tasks and behaviors impact our ability to stay present and in a parasympathetic dominant state. So after the hydrotherapy and the sleep hygiene, we'd also use homeopathic medicine. Y'all know what homeopathy is? Homeopathy is treating people with very dilute substances that, if taken in excess, would provoke a picture of symptoms. And if you present with a similar picture of symptoms to that remedy, you would be dosed very low dose with that substance. And it is absorbed through the electromagnetic cellular feedback loops in your body. It's absorbed in your bloodstream and then impacts that electromagnetic feedback in your body to allow your body to shift back into your normal pattern, whatever that is. So hard to explain. It's one of those energy medicines like acupuncture that is challenging to explain, but if you can prescribe it appropriately, just allows people to say, well, there's no really big change, but I feel more like myself. Homeopathic medicine. And then we move on to behavioral medicine, which is addressing those behaviors that we have built up in our lives in the evenings and around sleep. And botanical medicine, which is one of my loves because they're amazing, using plants to help rebalance systems that are overstressed and out of balance. Nutrition and acupuncture. I made a typo here. That's supposed to be on its own line. Acupuncture. Ayurveda. Anyone familiar with Ayurveda? Ayurveda is the medicine of India, and they have some hands-on treatments that are really beneficial for restoring sleep. And then stress management, which is part of every treatment for insomnia, no matter what's causing it. So helping us learn how to manage ourselves and our own tendencies more effectively. So what does that all mean? Okay. Sleep hygiene. So with sleep hygiene, it's not only ensuring that your bedroom is dark. People sleep more deeply and for longer periods of time if you're sleeping in a room without any light disruption. And that can include things like the glowing dials on the TV, on your clock radio, on your stereo or any other electronic equipment that may be present in your bedroom. With people who have long-standing sleep problems, I will often recommend that they use the strips and then turn them off at night to turn off all electronics in the bedroom, or that they move the electronics out of the bedroom. Get a wind-up clock that's a wind-up or a battery-operated clock that does not have a glowing radium dial. So you can't wake up, you have to turn on a light to see what time it is you're waking up in the night. Or it becomes less important. Yeah.
Well, if you cover over all those red and green and blue things, is it the electric that's going on, you think? Or, so you don't see it?
Yeah.
What do you think?
That's a really good question. And there are some scattered small studies that indicates for some people, those electromagnetic fields are very disruptive. Especially, and what I've seen in my own patients through the years is that's especially true in people who have been very, very ill and they don't have that reservoir of, they are highly sensitive to any stimulus of any kind. So in that case, yes, for most people, not as much. If you're covering it over, that's often enough. Making sure you have curtains that are really keeping all the light from coming into your room. Making sure your bedroom's not too hot or too cold, which can be challenging if there are two of you with different body temperatures sleeping in the same room. But there are people who've thought of these things, and you can actually buy duvets that are really light and less warming on one side of the duvet and heavier on the other, or blankets that do the same thing. It's amazing what you can find these days. Yeah.
So the trade-off between cool air,
Uh-huh.
that you need to have a window open
Yes.
That's been, for me, like I love fresh air, but,
Yes.
how do you get fresh air and not have light?
So you can get a fan that actually is silent. Some of those silent fans that make absolutely no noise whatsoever. The bladeless fans that blow air on you, so you have the illusion of having air on you. But if it's noisy outside, opening the window disrupts more than the fresh air helps, unfortunately.
I'm not even talking about noise, I'm talking about light.
The light coming in the window, it gets through the curtains. If you have curtains, if you have, that fresh air sort of creeps in around the edges. But yeah, it won't be blowing on you directly. In that case, I usually, if you want something blowing on you, which by the way would be what we call in homeopathy a rare and peculiar. It's one of those things that helps us decide, a symptom that helps us decide between remedies. That you would need that air blowing directly on you would be one of those things we'd consider. Because that is a release for some people, that movement calms the mind and the body. For others, it actually is stimulating and would wake you up. So, and then noise is a factor. Doing what you can to buffer the noise level. Sometimes you have to close a window, even though you like fresh air. Get a sound machine, the ones that you can turn to the waves of the ocean or the birds or the river, and you can actually set it on a setting where it will start at one sound level and gradually decrease and lull you to sleep. You can wear earplugs. You can wear eye masks. If you are going to use any of those things, make sure they're fitted well and they're comfortable for you. You can also just get a fountain, a small fountain that you keep, water fountain that you keep in your bedroom that just trickles slowly and masks some of the external noise. So, and we also want to work on restoring your nervous system so you are not as sensitive to all of these external factors. And I think that's the underlying approach for most naturopathic physicians. What can we do to help restore your own ability to withstand these stressors in every form? So the other piece that many of us are impacted by is stimulation. Speaking of, so stimulation from watching television, talking on the phone, being on Facebook, working up until the last minute before you go to bed, cleaning house, doing laundry, whatever it is, all that list of tasks that no matter how much you get done in a day, never ends. You want to avoid any of this stimulating input, just input. I think of it all as input. For at least a half an hour, and for some of us it needs to be a full hour before bed. You want to engage in an activity that is more calming, focusing, and relaxing.